Dr. Kahan, we have talked a lot about diabetes and how a podiatrist is super important for A, maybe detecting it, and B, if you have it, making sure that the circulation in the leg, foot keeps going, and thus the toes and the whatever doesn't have to be amputated. Now, there's such a thing like as a diabetes shoe. How is that shoe different from a normal shoe, and what does it do?
Excellent question. I'll tell you what, right off the bat, I'm gonna throw this out here. If you are diabetic and you do not have proper shoes, and you don't call me or your podiatrist if you're in another state or town, you better stop the video right now and call and make an appointment immediately, because you're making a huge mistake. Diabetics and shoes. Many points. Very brief. The diabetic shoe has a number of it's the materials that it's made out of, the fact that it's a deeper type of shoe. The shoe that you buy at the shoe store, and nowadays a lot of people think the shoe store is Walmart or the drugstore. That's not the place to buy shoes, folks. I'm going to even frown on department stores such as JCPenney's, Kohl's, and I hate to mention names. They do have some good shoes, but if you're a diabetic, they may not be for you, and you need to know about this. Diabetic shoes have extra depth to them. They need to accommodate a very specific type of insole that we're going to give to you, dispense to you, show you how to use. It's not just put it in, set it, and forget it. They need to be changed on a frequent basis. Every 3 months, you need a new insole that goes in your shoe. And we're not talking about a $300 insole that you got to pay, for a custom insole. We're talking something that's very inexpensive, but it's very effective in what it's designed to do, which is designed to preserve your skin, prevent your skin from breaking down, let your foot breathe, air in, air out. It's kind of like your lungs, air in, air out. The shoe has got more depth to it. We can put an extra depth cushioned insole in the shoe, which works like a custom orthotic. Your foot will actually mold itself right to that insert. We're going to do that also. We're going to mold it, but over time, a few weeks, your foot's going to mold directly to this specific type of insole. And guess what? You know what the best part of this is that in some instances, your insurance will buy you a pair of shoes every year with these special insoles in them. You have to qualify. We do a complete evaluation, and there's a laundry list of qualifications. Most diabetics qualify for them. And talk about a phenomenal program that Medicare has put together. Medicare hasn't done a lot of things right in a lot of people's opinions, but the fact that they have put together what they call the shoe program has prevented a lot of people from ending up in the hospital, losing toes, losing feet, losing legs, and that's what this whole program is about. It's about keeping your body parts intact. That's the bottom line.
I might have missed that, but so what? In one sentence, if possible, what does a diabetes shoe do?
It's the proper fit, number one, of the shoe, and secondarily, it's the insert, which in more ways than one is custom molded to fit every groove, every contour of your foot.
I got it. So what does the custom molding and the proper fit, what does that do to the foot, which is specifically beneficial to a diabetic guy?
Prevents the skin. It prevents pressure points. It reduces pressure points that may already be there. Maybe as a diabetic, you've already had an ulcer on the bottom of your foot. It accommodates. It prevents that ulcer from potentially coming back. It prevents new ulcers from potentially coming on. It prevents the skin from breaking down. It's designed to help the skin from breaking down and from getting infected. Diabetics are very prone to skin breakdown because of their poor circulation problems, because of their poor nerve condition, which eventually happens. So it preserves the skin and function of the foot.
Got it. And so I guess it keeps it circulating right and all that stuff. It doesn't shut off any circulation already, since that's a difficult part, and it makes it living and breathing the way it should be. That's what a custom.
Exactly. There are very, very, very specific guidelines on the way the shoe has to be made. Again, for that exchange of air, proper breathing in the shoe, exchange of hot, cold, etc. And that combined with the custom insole inside the shoe, that's the winning combination. For diabetics.
Well, I guess the custom insert in the shoe is making all that happening. Wonderful. Thank you very, very much. And good to hear that Medicare does actually quite take care of it. Now, one question. Are those shoes very ugly? I mean, am I looking like I'm just going up on the mountains and everybody looks at me when I walk through the shopping mall? Or what's the deal there?
Another good question. Current times, I'll tell you what, there are many, many beautiful looking shoes that you would think, that's a diabetic shoe? Shoe companies are getting smart. Some of the big shoe companies, New Balance, tremendous running company. In fact, I think it's one of the only remaining shoe that's made in America that's a running shoe. The shoes most people would not recognize now as being a diabetic shoe because the companies are getting smart about making an everyday dress shoe, walking shoe, running shoes that are made for diabetics. Imagine that. Anything from a slipper to a work boot are now in a quote diabetic style, and you would never think twice about buying it if it was in the store.
Wonderful. Good news. Very good. Because that's, like with food, there's this saying out there, if it tastes good, it's bad for you. If it tastes bad, it's good for you. Probably not true, but, so thank you very much, Dr. Kahan.